Hello everyone! Today I'm here to help you crack the NCLEX RN by simplifying multiple sclerosis or MS. Let's dive right in. Multiple sclerosis or MS is a chronic and progressive autoimmune disorder that affects the central nervous system, including the brain and spinal cord. This leads to impaired nerve impulse transmission. Basically, the immune system mistakenly attacks the myelin sheath of neurons, resulting in inflammation, demyelination, and axonal degeneration. Over time, this slows down nerve conduction and causes neurological deficits. Now, Mississippi comes in different types. First, we have relapsing remitting MS, or RRMS, which is the most common type, affecting about 85% of those with MS. This type is characterized by periods of exacerbation, or relapses, followed by partial or complete recovery. Second is primary progressive MS, or PPMS. Here, there's a steady worsening of symptoms without distinct relapses. Third, secondary progressive MS, or SPMS, which initially starts as RRMS but later progresses without remissions. And finally, progressive relapsing MS, or PRMS, which is the least common. It has a progressive disease course with acute relapses but no full remission. Signs and symptoms of MS can be highly variable. Early symptoms include fatigue, vision disturbances like blurred vision, optic neuritis and diplopia, muscle weakness, spasticity, and paresthesia, which is numbness or tingling. Later symptoms can include ataxia, tremors, dysphagia, dysarthria, cognitive impairment, and bowel or bladder dysfunction. Diagnosing MS isn't straightforward. There isn't a single definitive test. Instead, it's based on a combination of MRI, which detects brain and spinal cord lesions, lumbar puncture for increased IgG antibodies and oligoclonal bands in CSF, and evoked potential tests that show delayed nerve conduction responses. Nursing considerations and interventions are crucial in managing MS. First, managing fatigue by encouraging energy conservation through rest periods and prioritizing tasks, avoiding heat exposure, and promoting regular low-impact exercise like swimming or yoga. To prevent exacerbations, it's vital to reduce stress, infections, and temperature extremes, encourage a balanced diet, and monitor for triggers. For mobility and safety, fall precautions are essential. Use assistive devices like canes or walkers, and incorporate stretching and physical therapy for spasticity. Active range of motion exercises are also encouraged. Managing urinary and bowel dysfunction involves monitoring for urinary retention or incontinence, promoting scheduled toileting, and intermittent catheterization if needed. A high-fiber diet and adequate hydration are key for bowel health too. Pain and spasticity management can be achieved using muscle relaxants like baclofen and tizanidine, analgesics, anticonvulsants such as gabapentin and pregabalin, and non-pharmacologic methods like heat packs, massage, and stretching. Cognitive and emotional support includes encouraging memory aids, providing emotional support through counseling and MS support groups, and addressing depression or anxiety with SSRIs if needed. Pharmacologic management includes disease-modifying therapies that slow the progression of MS, like interferon beta, glatiramer acetate, and monoclonal antibodies. Symptom management involves medications like amantadine and modafinil for fatigue, baclofen and tizanidine for spasticity, gabapentin and pregabalin for pain, and oxybutynin and bethanacol for bladder dysfunction. Remember these NCLEX tips. Prioritize safety first with fall prevention and assistive devices. Educate patients on avoiding heat due to Uthoff's phenomenon. Encourage energy conservation with scheduled rest periods. Emphasize early treatment for better outcomes, and always monitor for infection due to immunosuppressive therapies. That's all for today's guide on multiple sclerosis for the NCLEX RN. Keep these points in mind and you'll be well on your way to acing your exam. Good luck!